Welcome to HITshow, your go-to source for today's leading healthcare business headlines. I'm your host, Steve Daly. Today is Wednesday, August 6th, and here are our reporters with today's headlines.
Hinge Health sees record Q2 growth as employers lean into musculoskeletal care.
UnitedHealthcare's latest policy change has hospitals sounding the alarm again.
Cohere Health lands on Forbes AI 100 as the prior auth battle escalates.
Elation Health rolls out built-in AI tools across its EHR, no added cost, no outside vendors.
Precision cardiology gets a Wall Street boost with HeartFlow's IPO debut.
That's a lot to cover. Let's get into it. Our first story shows just how hot the digital MSK space still is. Here's Xavier Banks.
Hinge Health posted record second quarter revenue driven by a wave of new employer contracts and growing demand for virtual musculoskeletal care. The company says its member base has nearly doubled year over year, thanks in part to expanded benefits partnerships and deeper clinical integrations. Hinge also rolled out new tools this quarter focused on chronic pain and post-surgical recovery, further differentiating itself from competitors like Cohere Health. With employer healthcare costs still rising, demand for measurable ROI in digital health is only accelerating. Hinge says its latest growth reflects growing employer demand for solutions that improve mobility and reduce claims costs.
MSK may not be flashy, but it sure is sticky and profitable. Let's shift from earnings to outrage. UnitedHealthcare's latest policy move has triggered another provider backlash. Anika Shah has the details.
UnitedHealthcare is facing fierce pushback after announcing a new policy requiring prior authorization for more outpatient procedures, this time focused on GI endoscopies and advanced imaging. Hospital groups say the decision could delay care and burden clinicians with additional paperwork. In a joint letter, several health systems argued that recent authorization expansions contradict CMS efforts to reduce administrative burden. This comes just weeks after UnitedHealth's Q2 report revealed significant medical loss ratio pressure, raising questions about whether the policy changes are financially motivated.
Another round in the never-ending battle over prior auth. The gloves are off. Hospitals are fed up, payers are under pressure, and that brings us to one startup right in the middle of the storm. Teresa Vaughn has this story.
Cohere Health has been named to the 2025 Forbes AI 100 list, marking its rise as a key player in healthcare's AI-powered future. The company's platform streamlines prior authorization by using machine learning to review clinical documentation and auto-approve care plans when appropriate. Cohere says this approach slashes delays, reduces abrasion between payers and providers, and improves outcomes. They've recently expanded partnerships with major payers like Humana and Regional Blues, and also launched new specialty modules for cardiology and orthopedics. With prior auth pressure mounting from all sides, Cohere may represent one of the few models both providers and payers can agree on.
HITshow is made possible by Altera Digital Health's Sunrise EHR, the flexible solution that provides tools and technology clinicians need to deliver better care, their way. The journey toward the summit of healthcare has begun, and through partnerships built on trust, Sunrise is helping healthcare organizations bring next-level care within reach.
You're listening to HITshow. Next up, a primary care-focused EHR vendor is making waves with its all-in approach to AI, rolling out new tools across its platform at no extra cost. Here's Nate Collier with more. Nate?
Thanks, Steve. Elation Health has just launched a suite of native-built AI tools embedded directly into its cloud-based EHR platform. These include AI-generated clinical notes, decision support, and coding enhancements, all offered to customers at no added cost. CEO Kina Fong says this move is about reducing clinician burden and enhancing value-based care. Unlike other vendors who are layering AI through partnerships, Elation is building it all in-house. The goal? Keep primary care providers focused on patients, not paperwork.
That no extra cost piece really stands out, especially when others are tacking on big fees for similar tools. Nate, did they say how soon this will be live?
Yes. They've already begun rolling it out to practices nationwide, with full availability expected by early fall.
Appreciate the update. Let's shift now from the tech side of care delivery to the financial world, where one precision cardiology company generated some heart-pounding news on Wall Street. Here's Jade Romero.
HeartFlow, the precision cardiology company behind FFRCT analysis, debuted on the NASDAQ yesterday under the ticker HFLW. The company's non-invasive imaging tech helps cardiologists assess coronary artery disease without requiring a traditional angiogram. HeartFlow's IPO raised over $400 million and drew strong investor interest, signaling a renewed appetite for diagnostic innovation in public markets. The company says it plans to expand R&D into other cardiovascular conditions and double down on partnerships with leading health systems.
That's more good news from the IPO world. It's a nice beat to end on. Literally. That's all the time we have for today. Thank you for joining us on HITshow. If you like these stories, please follow us on LinkedIn and check out our in-depth feature videos on HIT.show. HITshow, your go-to source for healthcare business news, can be found all the places where podcasts are heard. Please join us again tomorrow for the latest headlines in healthcare. HITshow is made possible by Vital. Ranked #1 in patient experience by KLAS, Vital uses AI to give patients real-time updates, plain language test results, and discharge instructions they can actually understand. Vital, because the experience matters as much as the medicine. Learn more at vital.io.